Hi, and welcome to today's edition of In Medicare News. Today is Friday, March 13th, 2020. I'm going to be doing a lot of reading, and I'm going to just be putting this up and out. I'm actually not going to do too much editing or any cutaways or anything for it. I just want to get the information to you. What I'm talking about today is insurance and Medicare response to the coronavirus, COVID-19 as it's called, or some other things, I don't know. I'm not going to go over the basic stuff that you can get from people far more knowledgeable than me about what to do to avoid it and everything. I just want to talk about insurance, and specifically Medicare insurance, and more specifically Medicare insurance for people in Ohio. And if you want to get even more specific than that, primarily the types of insurance that we offer to our clients. So this is a public service really for that. The stuff that we sell is the stuff that the public generally gets. If you want to find out about how employer coverage or something else, your specific coverage is going to work and you're not one of our clients, talk to whoever you got it from. It's their responsibility to get you that information. But what I wanted to do is first of all tell you how Medicare is treating this. And Medicare put out a bulletin just a few days ago for basically all coveragees. This is everybody on Medicare Part A and Part B around the United States. And I'm going to skip through a couple of these things that don't really pertain to what we're talking about. Your health, safety, and welfare in the face of the 2019 novel coronavirus is our highest priority. Older people may be twice as likely to have serious COVID-19 illness. This means that most people with Medicare are at higher risk. Let's see here. Precautions to take now. I'm not going to go over that. I will have the link to what I'm reading right now so that you can see it yourself. And this is the printout as of today, by the way, Friday the 13th, 2020. Preparing for healthcare needs. Medicare covers related needs. Medicare covers the lab tests for COVID-19. You pay no out-of-pocket costs. Now, I'm going to come back to that in just a moment. Medicare covers all medically necessary hospitalizations. This includes if you're diagnosed with COVID-19 and might otherwise have been discharged from the hospital after an inpatient stay, but instead you need to stay in the hospital under quarantine. I want to make sure you're aware, Medicare covers that. That means Medicare Part A covers it, Medicare Part B covers it. If you have a traditional Medicare supplement, Medigap insurance, you have the coverage for that as well, because Medigap covers everything that all Medicare approved charges, and I just read to you that Medicare approves these charges. If you have a Medicare Advantage plan, we'll get to in just a moment. At this time, there's no vaccine for COVID-19. However, if one becomes available, it will be covered by all Medicare prescription drug plans, Part D. So be aware of that. If you have a Medicare Advantage plan, you have access to these same benefits. Medicare allows these plans to waive cost sharing for COVID-19 tests. Many plans offer additional telehealth benefits described beyond the ones described below. Check your plan about your coverage and costs. So be aware of that. Medicare Advantage may not necessarily pay 100% of the costs. We're going to get to that too after I finish this, but Medicare Advantage seems to be coming on board. For the most part, the biggest companies do seem to be saying that they're going to be covering it fully with no co-pays. It is not a guarantee, though. You do have to check with your specific plan. Medicare supplement people, you don't have to check. It's just covered. You can go. Telehealth and related services. Medicare covers virtual check-ins. You can connect with your doctor by phone or video, or even an online patient portal to see whether you need to come in for a visit. If telehealth is available in your area, that's great. Use it. If you're comfortable using it, great. If not, just go where you need to go. Other ways Medicare is helping. Every day, Medicare is responsible for developing and enforcing the essential health and safety requirements that healthcare providers must meet. They take additional steps, including establishing new codes to allow providers to correctly bill for services related to diagnosis and treatment of the illness, instructing our national network of state survey agencies and accrediting organizations to focus all their efforts on infection prevention and other cases of abuse and neglect in nursing homes and hospitals. A couple others here, but ensuring important guidance, answering questions that nursing homes may have with respect to addressing cases of COVID-19. So that's the Medicare Bulletin. Now, they did have a little section under the topic of is my test, item, or service covered. This one's new. The coronavirus test. And this, again, is direct from Medicare. I'll have a link to this page on this video. Medicare Part B, medical insurance, covers a test to see if you have coronavirus, officially called 2019 novel coronavirus or COVID-19. This test is covered when your doctor or other healthcare provider orders it if you got the test on or after February 4th, 2020. Your costs in original Medicare. You usually pay nothing for Medicare-covered clinical diagnostic laboratory tests. Note, your provider will need to wait until after April 1, 2020 to be able to submit a claim to Medicare for this test. So if you had the test done after February 1st, your doctor has to wait until after April 1 to submit it. If the doctor has submitted it and you got a bill for it, go back to the doctor and ask to resubmit it after April 1st. I'll say that again. If you got the coronavirus test after February 4th, 2020, and you're on original Medicare, not a Medicare Advantage plan, they'll follow their own rules. But if you're on original Medicare and a supplement, and you got the test on or after February 4th, 2020, and the doctor submitted the claim to Medicare before April 1st, go back and tell the doctor to resubmit it after April 1st to get that covered. These are tests that are going to be done to help your doctor diagnose or rule out a suspected illness or condition. That is what Medicare says. Now, that is everybody across the United States. So if you have Medicare Part A, Part B, regardless of what state you live in, that is the basics that Medicare is doing. Now, Ohio, the state of Ohio put out a bulletin March 11th, 2 days ago. I actually just got this yesterday. I was too busy. I wasn't able to make this video until today. This is bulletin number 2020-02. I am going to read a lot of this. Now, I also service West Virginia and Kentucky. I haven't seen anything for Kentucky yet. I got one for West Virginia. It's in the same vein as this, although it's a little bit, it's not quite as stern as Ohio is. But I wanted to read this. So this is for everyone, all residents of Ohio only. This bulletin pertains to all insurance companies and other entities transacting the business of insurance in the state of Ohio that have delivered, issued, or used policies of sickness and accident insurance and or travel insurance in Ohio. This is not for public, so you can get this. This is public information, but this is not something that goes to you. This is a bulletin that went from the Ohio Insurance Commissioner to the insurance companies, giving them instructions on what to do here. So I want you to be aware what instructions the insurance companies were given in Ohio. The purpose of this bulletin is to notify companies of the request of the Superintendent of Insurance that companies ensure members have access to needed healthcare services to test for and treat COVID-19 by promoting access to coverage. To date, there have been 3 confirmed cases of COVID-19 in Ohio. As the situation develops, issuers can help ensure access to coverage by considering any necessary and appropriate methods for reducing barriers to access for these services. Travel insurance. Issuers of travel insurance are reminded that unless a specific exclusion applicable to COVID-19 applies, a travel insurance policy that covers sickness, accident, disability, or death occurring during travel must cover such risks related to COVID-19 according to the terms of the policy. Many travel insurance policies also must cover cancellation or interruption of a trip or event, emergency transportation, and/or costs of returning to the United States for further treatment pursuant to the terms of the policy. In other words, this was the insurance commissioner saying that if you have travel insurance, which is insurance that we offer to our international traveling consumers, your policy is expected to cover this unless this is specifically excluded. And I looked through what we have. This is not specifically excluded. So if you have travel insurance from us, you're on an international trip, the insurance commissioner is expecting your insurance to cover it, which means they'll cover it. Health insurance coverage. They're just saying health insurance coverage. In this case, it does cover more than we offer, but this also does fall into the area of what we cover. Most comprehensive major medical policies offered in the state of Ohio provide access to coverage for ambulatory services, emergency services, hospitalization, lab tests, and prescription drugs when medically necessary, subject to the terms of the policy. Certain short-term limited duration or other accepted benefit plans are not required to provide these services. Issuers should have customer service representatives and helplines readily available to provide helpful and accurate information to assist consumers with questions about the terms of their coverage with respect to COVID-19 related services. Issuers of sickness and accident policies are also reminded of the following obligations under federal and state insurance law. Emergency services. Emergency care must be covered without pre-authorization and must be covered at the same cost-sharing level as if provided in-network. Health insuring corporations providing coverage in Ohio must also cover out-of-network emergency services without balance billing. Additionally, issuers should be advised that when applying the prudent layperson standard to services for emergency care, COVID-19 and the associated symptoms must be considered. Okay, in a nutshell, that means that if you are going to an emergency room or getting emergency services for things related to the coronavirus, it is expected that it will be covered without any balance billing, and associated symptoms are to be tested with it as covered events. Utilization management. I don't think we have to worry about this one on the insurance agent to insurance consumer side. Telemedicine. Issuers that provide coverage for services delivered via telemedicine are expected to provide such coverage for COVID-19 testing and treatment. Issuers that do not currently provide this coverage are encouraged to implement early adoption of the Ohio law requirements effective January 1, 2021. Basically, that means that there's an expectation Ohio is going to be requiring telemedicine options under certain conditions. The insurance commissioner is highly encouraging insurance companies adopt it earlier than that to take advantage of this crisis that's going on. Under those requirements, issuers are prohibited from excluding coverage for a service that is otherwise covered under the health plan solely because it is delivered by a telemedicine service. What that means is if something would normally be covered normally has to be covered in person, but it can be covered by telemedicine right now, the insurance company will be required to cover it under telemedicine. Issuers are also required to cover telemedicine services on the same basis and to the same extent that the plan provides coverage for in-person services. The state of Ohio is requiring that if you were to get coverage can't be reduced or somehow limited because it's being done telemedically, if it could also have been done in person. They're trying to help enforce the quarantine by saying you can utilize telemedicine services the same way and at the same level you can utilize it in person if you wish and are capable of getting it via telemedicine. Then there's things about appeals and external reviews. Issuers must afford insurers the opportunity to submit adverse benefit determinations for appeal. The very similar stuff to what's going to what Medicare people see anyway, nothing really different. Access to providers. Issuers should ensure that provider networks are adequate to handle testing and care for COVID-19. In certain instances, if the issuer does not have providers in its network to meet these needs, the issuer must provide access to out-of-network providers at in-network cost sharing. This is something not every state has to deal with, but Ohio sure as heck does. If you live in a rural area, and I service a lot of clients that are rural, if you live in a rural area and there is not adequate medical providers, insurers will be required while this is going on to provide COVID-19 testing at in-network costs. Now, I'd say before you just jump the gun and do something, call the insurance company and ask them first. Call me if you're my client. Call your insurance agent. Find out if you need to see someone that for a COVID-19 test and you don't happen to have anyone that's close that's in network. But I'm pretty sure they're going to be, you'll probably get it covered without an issue. And again, if you have a Medicare supplement, this isn't an issue at all. You just go to a Medicare provider, you're good. Prescription drug supply. Issuers that cover prescriptions must provide access to a standard and expedited formulary exception process for non-formulary prescription drugs. Issuers are also encouraged to consider allowing insureds to access prescription drug supplies beyond the typical supply limit with appropriate exceptions for controlled substances, even if the scheduled refill date has not been reached as medically appropriate. Basically, insurers are being asked to make sure that determinations for formulary exceptions, in other words, if you have a drug that's typically not covered by insurance, will the insurance company make an exception? Make that exception quickly, within 24 to 72 hours. Accessible and accurate information. Make sure clients have the opportunity to get it. That's what I'm doing here too. So that's what the state of Ohio says. It basically says you've got a decent opportunity to get coverage where you need it, when you need it. Now again, if you have major medical coverage, you've got to check with your employer about anything specific to that. If you've got a Medicare supplement, which means you have Medicare, just go. If you have a Medicare Advantage plan, for the most part, you'll be okay. I do want to go over this, though, and I'm not going to say the name of this company, but this company is one of the larger Medicare Advantage insurance companies. The others seem to be falling right in line with this. Again, with Medicare Advantage, you do need to check with a specific company. There is a chance you could have a company that's not going to do exactly what I'm saying. That's the risk you run if you're in a Medicare Advantage plan. They work on their own rules, but for the most part, they all seem to be following this. This one is just pretty easy to read. In response to the rapidly evolving COVID-19 outbreak, this company announced a series of steps designed to support the health and well-being of its members, ensure patient access to medication, remove barriers to care. Effective immediately, this company will waive copays for all diagnostic testing related to COVID-19. This policy will cover the cost of physician-ordered testing for patients who meet CDC guidelines, which can be done in any approved laboratory location. This company will waive the member costs associated with diagnostic testing for all commercial, Medicare, and Medicaid lines of business. Although there are certain employer-sponsored plans, they are able to opt out of it and may keep the copays in. For the next 90 days, this company will offer 0 copay telemedicine visits for any reason. Members should use telemedicine as their first line of defense in order to limit potential exposure to physician services. Cost sharing will be waived for all virtual visits through their telemedicine offerings and in-network providers delivering virtual care. Again, certain employer plans do have the right to not do that. The preferred pharmacy connected with this plan, this one is actually a little more specific to this, but I will mention it because the others may do it too. The pharmacy connected will waive charges for home delivery of prescription medications. Most companies don't charge for home delivery of most medications unless you need it rushed. This one will waive it. This company will now offer 90-day maintenance medication prescriptions for commercial, that's most employer plans, and Medicare members, and is working with state governments to make sure the same option is available to Medicaid members where allowable. This company will waive early refill limits on 30-day prescription maintenance medications. So that also seems to be coming up with other companies. They're going to send a special care package. This one's unique to these guys too, although again I expect some more stuff to happen. Through existing care management programs, this company will proactively reach out to members more at risk for COVID-19. That actually is something I seem to be seeing more. There are care managers associated with Medicare Advantage. It's not uncommon to get a call from a care manager if something kind of pops up in your medical records. In this case, if you're seen as more at risk, you might get a call as well about this. Just screen your calls. It could be spam, it could be legit. If it's legit, make sure they're identifying themselves as being from your insurance company. Make sure they identify themselves as with the name of your insurance company, please. Not just the health insurance, not the Ohio Department of Health, the name of your insurance company. Make sure they use that. This company is also offering its Medicare Advantage plans virtual check-in and evaluation benefits. That seems to be something that's going on with some of the other companies as well. So that's what's going on there. I went a little bit longer than I normally do. We're pushing 23 minutes. I'll have the links to these up. Basically, in a nutshell, Medicare is covering things beginning April 1st. They will waive all fees associated with it, which means the supplement's not going to leave you anything else, not even your deductible. If you did it between February 4th and April 1st, make sure the bill doesn't get submitted until after April 1st. If it does, you have a charge. Give it back to the doctor. Tell them to resubmit it. If you have a Medicare Advantage plan, check with your plan, but it sounds like for the most part you're going to have most of your stuff taken care of. And if you're in the state of Ohio, you're going to have less network restrictions if you've got a network restricted plan. If you have travel insurance, expect that travel insurance is going to pick it up. If you have employer coverage, check with your benefits administrator to find out if there's anything there. If this is something that you're concerned about, if you want to utilize your insurance and you have an employer-sponsored or third-party sponsored plan, check with them to find out benefits specific to your situation. My supplement people, you don't have anything to worry about. Just go get what you need. When something comes up on the drug plans, it's going to be covered. If you have a Medicare Advantage plan, I'm still waiting to hear from, I think, 3 of my plans, but the others all seem to be covering them without any sort of issue. You're not going to have an issue. If you call my office, we're just going to tell you just go. It's going to be taken care of. I doubt there'll be any copays. If you ask me something specific, I can tell you specifically if there's a copay. If you don't have an insurance agent, call the insurance company. Just basically go get the care you need. That's all I have. Any questions, shoot us an email. I'm going to leave this up. You guys can put in comments if you want. Please don't turn this one into a diatribe about how governments aren't, you don't think you're unhappy with the response the government is giving. You're unhappy with the response the insurance companies are giving. I don't want to do this. The whole point of this one is to kind of just let you guys know what's going on, share a little bit of the knowledge and the extra access that I have, the ability to access public information about insurance and disseminate. I just kind of wanted to share this with you. This isn't one of those things I really want to get into petty bickering or anything with whatever your thoughts are about insurance companies, the federal government, the state government. This is a real thing. There's real quarantine. This hasn't happened at any point in my life. The closest, I was thinking about this last night, the closest something like this has come up is in the 80s when it wasn't even health related, but as a young child I was concerned about, the Soviets attacking us because that's what society kind of ingrained in me. Nothing like this has happened. Nationally, nothing like this has happened in my parents' lifetime either. I mean, we need to go back to my grandparents' era to actually find something like this. So, and please, no, let's not try to push anything with bickering about whatever you feel is the inadequacy about insurance in this case. Let's try to pull together, use whatever resources we can for getting our information out to the people that really need it, and let's kind of stop this disease or virus or whatever it is before people really do get hurt or killed from it in large numbers. Thank you. Any questions, shoot me an email, give me a call. Otherwise, take care, stay safe, and be good to each other on the internet, please. Thank you.